Hello out there in television land, and Happy New Year. Welcome to yet another adventure, listening to It's Your Health, your leader in healthcare information. I'm with the Fipster here as our co-pilot, but he actually is a pilot, so
let's get busy going.
Okay. We're going to be taking off shortly. We'll be right back after this brief commercial message. Remember to check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back. Welcome back to the first segment of It's Your Health, the fastest 30 minutes in television land. Right, Fipster?
I thought the fastest one we did was just with Danny.
Okay.
But well, we'll see if this one's faster. I don't know.
You know, youth is wasted on the young, I always say so. But let's go get to work and do our headlines.
Alrighty. Naprosyn bests Tylenol with codeine for dental surgery pain.
Well, perhaps not too surprising. We're, of course, in a opioid epidemic, and we're trying to limit the use of opioids. So it's nice to see that naproxen short-term will help with the dental pain. We're not fans of non-steroidal anti-inflammatory agents for the long run because?
Lots of reasons. Heart attack, stroke, increases risk of those, kidney failure, ulcers, you name it. Have to find better ways to treat pain. Certainly narcotics are not in vogue anymore, and NSAIDs have not been in vogue for some time. But for as needed use, that's truly as needed, I think they're a little bit safer.
Very good. Moving right along.
Glycopyrronium, or topical Cubreza, wipes for hyperhidrosis, or excessive sweating.
Yeah, we see this a lot. It's very debilitating if you have it. Excessive sweating. I think this comes as an oral agent as well, but they're talking here about wipes.
Right, this is a topical version. They actually have been using these medications sometimes for hospice patients with excessive secretions, or sometimes patients who have cerebral palsy. They can have excessive drooling, and they'll be used for that. They're not without their charm. You know, from an oral standpoint, lots of side effects. In fact, that's why you're using them. From a topical standpoint, I have yet to prescribe this, but it certainly would be safer to use, and it would have very limited side effects, I think.
Sure. You heard it first on It's Your Health.
Statins may slow brain decline.
Well, here we go again with statins and the pros versus the cons. This particular article went on to say that statins, being antivascular perhaps and cutting down on plaque formation in your arteries, may actually help in terms of slowing brain decline as well. I'm not sure. We have to kind of wait and see, but again, another pro for a statin.
So, the kind of thing, you know, a couple of physicians in our area have recently retired after providing years and years of excellent service, and these patients now have to really just find a new practitioner. How do they go about doing that? What really is the most, and I sometimes ask, what is the best thing we can do to help new patients? What's the most important thing that you find in people seeking new health care?
In our microwave instant gratification society, we wanted it yesterday. Believe it or not, the ease of getting an appointment and getting in to see a practitioner is probably the number one, as this chart entails. Let's just go down it briefly, Phip.
All right. 61% responded ease in getting appointments. And that makes sense. I agree. You know, we live in a world where we push a button, we want an answer. And so being able to get an appointment versus saying, well, we can't see you for 4 months.
Yeah.
You're going to go find someone else.
Sure.
Okay. There was an oncologist locally said, you know, one of his patients used to brag about how her oncologist that she used to see in New York was so good that she had to wait 9 months for an appointment to see him. He was that good.
There you go.
And is that really the case? You know, I got always a laugh out of that. The next thing, the doctor's years experience. How long have they been working? Are they fresh out of school? Have they been doing it for 30 years? I actually find that surprising to be the second thing. Recommendation by a family or friend. I think that'd probably be the most important one. That falls lower on the list. What medical school they attended. I didn't even know people looked that up, but that's somewhat higher on the list. Same gender as the patient. In today's day and age, that still does exist. And lastly, race or ethnicity. Fortunately, we see that as a really low percentage, and that kind of makes a lot more sense.
Yeah, so we're going to start up a Burger King kind of a drive-by, so you don't even have to get out of your car. We'll just look out the window.
Alrighty, so now once you find that doc and you're happy, and now you get some news, you know, you have cancer, something bad's happening, or you know what, all those problems you're having, we can't find anything wrong. You're fine, and you just don't, it doesn't sit well. And you want to get a second opinion. How do you bring that up? Is that something that's kind of like a poo-poo, no-no, or is that something we encourage?
Truth trumps everything. No pun intended, by the way. But nevertheless, I think if you have a good relationship with your physician, your primary care provider, I think you ought to just say, listen, if you don't mind, do you mind if I get a second opinion? I think it'll set everyone at ease. We're not gods. We don't know it all. We're humans with human frailties, and the body is very complex. So if you're not happy with what you're hearing or what you're not hearing, then by all means, bring it to the attention. And most of us will say, yeah, we'll bless that.
Yeah, I don't have a problem with that. You know, I think it's a good idea to have a second set of eyes. And if a second set of eyes either confirms that everything's good or everything's bad, or does the opposite, you know, you can move forward. It's when you get third and fourth opinions that it does get a little out of hand. You know, you're kind of searching for an answer that doesn't exist. That's where you have to ask what you're really looking for.
Exactly.
Speaking of this, you know, this is kind of an interesting picture. You know, someone had a nasty virus and they noticed sometimes their nails change after that. What do you think?
Well, when we were learning, before we had all these fancy tests and MRIs, we would actually take a patient's hand and look at their nails. You could tell a great deal of things by looking at someone's nails. And this is in one instance where a infection decided to eat away at it, but just an interesting dermatologic issue.
Alrighty, moving on. Hand, foot, mouth disease. While we're sticking on, you know, viral infections and rashes, let's talk for a moment about hand, foot, mouth disease. What age group do we typically see this in?
I don't know, Phil. You're subject to this illness, I had heard, right?
Well, you know, it's usually you see this in kids. Like my youngest kid was actually in preschool, and they actually they tell you, oh, we have hand, foot, mouth disease in the school now. And that's usually very very catchy. Like if it's there, they're going to get it. And it's just kind of one of those illnesses kids are going to get. I believe it's the Coxsackie virus. And I was like, okay, fine. We put Jack in bed. He had his high fever. He gets over it, and he lives a normal, happy life. About a week later, I had a high fever, and it was about a week before I was running a Philadelphia half marathon, and I didn't think anything of it. Real high fever, 102, 103, real party. After the fever broke, felt better, my hand started to feel like I was playing with fiberglass and little shards of glass underneath. My feet were the same way, and I did not think anything of it, even though these little red marks. And then they developed into these blisters, and I couldn't believe it. That I didn't have that as a child. I must not have had it as a child, but I got it, and then the following week had to run, you know, a half marathon, which I used naproxen, by the way, to help get me through.
Oh,
and
there you
I was
go.
able to get through it.
Good move.
Do we have a chance to get through one more thing?
Yes. Here's a quick question. If we add up all the weight of the bacteria, inside and outside, how much does it weigh? Is it going to come close to a blueberry, an avocado, a pineapple, or a watermelon? And the answer is?
I don't know.
A pineapple. Most of us have, believe it or not, 2 to 6 pounds of bacteria in and out of our body. Probably in the gut most of all, I would think. But nevertheless, you heard it first on It's Your Health.
Pretty wild stuff.
All right, well, as we said, we have the fastest half hour. We're going to be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health. Phil Benyo with the Fipster, guiding us through the landmines of health out there.
Yeah, headline at a time. All right. Let's get to the first one. Vitamin D is not as effective for primary prevention of cardiovascular disease or cancer.
You know, again, it's like eating meat on Friday. We hear these things that are good for you, not so good, and then several years later, when more is known, they retract it. It's still good for bone health, by the way. So if you're out there in television land, haven't had your DEXA scan or vitamin D levels, get them drawn and done.
Right, I do. Vitamin D kind of felt the same way vitamin E did. There was a big push by cardiologists that this is going to be the brand new wave of the future, and it just has kind of fallen short. It's not bad, but it's not necessarily as good as we once thought. Moving on, omega-3 fatty acids do not prevent cardiovascular disease events.
Yeah, there was concern as to, again, we're in a diet where there's very low omega-3s, high omega-6s, which are vascular entities that can induce cancers and cardiovascular disease. We would hope that addition of omega-3s would sort of put the brakes on that, but it turns out not really so. I still like omega-3s. I think they help my back and my bones. I feel more limber on them and have a better complexion.
You know, it's just, as I'm looking at this article and thinking about it, you know, it's interesting. The prescription omega-3s recently actually added an indication for CV prevention, and it's actually a big deal for that particular company. I think it does help lower your triglycerides and has some other benefits. As to what it actually does and how much we thought it does, maybe not so much. But again, not particularly harmful. One little caveat though, excessive omega-3 has been associated with increased risk of atrial fibrillation.
Huh.
And that's something to think about, because some people do pound those things down.
Wow.
And there is some reports out there that it can induce AFib, and people will argue that back and forth, but there's starting to be some good concrete evidence of that. There's a lot of things that do. But you know, fish oil certainly can be one of them.
No doubt.
Lastly, pediatric cough and cold medicine recommendations.
You're
You
asking.
got a little, one of your grandbabies is coughing. You know, baby Daniel or little Jack is coughing and carrying on, snotty nose. What are you going to give them? Shut
Well,
them up.
you're asking a geriatrician about a pediatric question. Well, in the olden days, I used to give a little tincture of Dimetap, grape flavored.
It's delicious.
And it worked. In fact, I still use it myself, as a matter of fact. But the recommendations are what?
Do nothing.
Do nothing, yeah. Sit tight. Don't be given Dimetap, which has alcohol in it, which is probably why we like it. And just kind of let nature go its course, I guess.
You know, at the end of the day, your body is trying to get rid of something. And so by stopping up that, if there's something in your nose it has to get rid of, you're going to shed that out. So why dry that up and make things worse, you know? And so, you know, certainly in today's days and age, we talked about earlier, it's kind of fix it now. You know, you do have to just let these things run their course. And if you do, they run their course and you live a normal, happy life. Sometimes you'll be coughing for a couple of weeks. You know, that's just unfortunately how these viruses are. We're seeing a lot of that this time of year. All right, moving on. Let's talk about, you know, things that'll help, you know, childhood development. We're kind of on kids now a little bit. What are the things that are, you know, we can do to help our kids kind of have good memories, you know, grow up, have a little bit more rounded life?
Well, when we sat around for Thanksgiving and Christmas, the universal theme was reminiscing on places we had been. And I think that travel somehow tattoos a child's memory about a certain event. I mean, they may not remember 2 Thanksgivings ago, but they will remember when we went out to Notre Dame and watched them beat Penn State. So
I remember that. I was there for that game a couple times.
Yes.
Yeah, I saw that. I remember them getting beaten by USC, though. That was also one of my harder memories. USC always seemed to be better back when we were there. That was always tough. All right, moving on. Let's talk about managing pain, and not to sit and talk about a lot of difference between men and women, but at the end of the day, we are different creatures. You know, this recent article kind of took the difference between how men and women feel and perceive pain, as well as some of the health detriments to chronic pain in how it affects women differently. And I was surprised the degree of problems that are related to that.
Well, men are from Mars, women are from Venus, and if you haven't read that book, I recommend it highly. And yeah, I mean, just like women will perhaps metabolize alcohol differently, they have perceptions of pain, and their pain management is different. I can recall patients who have fibromyalgia, which are painful muscles, chronic condition, chronic fatigue. Generally, we see that in women, sometimes associated with sleep. And pain in women can actually detract not only from the quality of life, but the years given to a woman as well. They claim you can subtract a year off a woman's life for every 10 that they're in pain.
All right, that's shocking to me. And so I think the key, and it's treated differently. You know, there's higher incidence of opioid use, which is a big problem now, and you know, there's really not a place anymore really for chronic opioid use in these quote fibromyalgia type patients.
Right.
You know, there's different things to be done. You know, it eases the pain, but it creates a myriad of other problems.
Right.
So let's move a little bit more positive stuff. Let's talk about green tea and why we should all be drinking green tea.
Well, get a load of that list there, Fipster. There's 5 reasons to love green tea. You want to go through some of them?
Well, it contains disease-fighting antioxidants, so it can actually help you in the cold and flu season, maybe fight something off a little bit better. It reduces the risk for type 2 diabetes mellitus. I think that's pretty exciting. Anything we can do to lower the risk of one of the most impactful things in our country right now, that's a great idea. It helps boost your immune system. That kind of goes with the disease-fighting antioxidants. That's
right.
kind of 2 headlines in one. Reduces your cholesterol. That's been known for quite some time.
Right.
Is it going to lower your LDL 50 points? Absolutely not. But will it bring it down a couple more points along with all the other things you're trying to do in life? Absolutely. And it protects your skin. And the last one I would add, it actually helps as somewhat of an appetite suppressant. People who are trying to lose weight,
True.
You know, a glass of green tea a day can very much quench an appetite. It really doesn't, a lot of people get upset, oh, it has a lot of caffeine. Green tea has 1/5 of caffeine as a cup of coffee, so it really doesn't have that much caffeine. And they make decaffeinated versions, which will be just as good for you. I think that's pretty exciting. So I enjoy green tea every night, so I look forward to that.
Okay, here's another Jeopardy question out there. Which of the following situations causes your brain to shrink? High blood pressure, starvation, pregnancy. Time's up.
I was looking at it and I was like, well, I know starvation will. I really wasn't so sure about the other 2, and I was afraid to say it's pregnancy because that's not going to go over well.
Yeah, but
what's the answer?
All of the above, believe it or not.
Wow.
So it can shrink, certainly with age, and these other conditions can also tax the brain, if you will.
That's quite interesting.
It sounds like we're moving on to the next segment here, Fipster.
The third and final segment.
You know, this is a thing of time compression. You know, there's a theory that as we get to the end of the world, time is compressed. So that's why this is happening. Better do it now. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health. Welcome to the last segment of It's Your Health, and we're getting closer to the end of the world. Right back here, Fipster, with the headlines. Let's motor on.
Let's get through it because we've got a lot of stuff we've been pushing off. Gene-based prescribing is here. Are you ready?
I'm trying to get ready. I've had several patients come in with printouts of a test that says which meds are going to work and which ones won't, particularly like antidepressants, which was kind of useful information for me because a lot of times we're kind of throwing a dart at the wall hoping to hit the target.
Right, it's actually very interesting. What they're doing is they're looking at your genetic code to see what enzymes in your liver are more active and what are less active. And at the end of the day, it's these enzymes that decide how much this medication is going to stay in our system or how long. So if you have an enzymatic pathway that's going to delete a medication a lot faster, there might be a reason that medication is not working. You know, it's just, and I've had that patient say that, well, you know, we tried increasing the dose, it just doesn't work for me. And then other people, you give them just a sniff of it and oh my goodness, it works amazingly, or they have side effects. And so we're seeing this more and more. The patients I'm seeing now, it's a psychiatrist usually doing the test in the office. It's a little mouth swab. You have to watch though, the testing can be expensive. You know, that can sometimes be $1,000 plus, so you want to make sure your insurance is covering that testing. Next headline, medical cannabis. I can't believe you pulled this article. Medical cannabis found safe and effective in treating fibromyalgia.
This is the first headline on our pain management news journal that I get. Well, you know, we're starting to get more dabbling into medical marijuana and treating chronic conditions. Fibromyalgia is one of them. So we're seeing more of it.
Right, fibromyalgia is at least not on the specific list for Pennsylvania as far as what's allowed for medical marijuana, but there's a lot of ways next to that. You know, some chronic pain, neuralgia, sometimes the anxiety component as well. Anxiety was recently added to the list. It's certainly something to think about. My big problem with medical marijuana is I can't give you a sample to say, hey, try this, see how it works. You have to sit and get a card, you have to do this, you have to go through 3 months of stuff and spend money just to find out whether or not it might even work. And so they need to find a better way, and I think our state's getting closer and closer to finding a better way. Lastly, diagnosing dementia and clarifying the goals of care.
Yeah, that could be a show in itself. Diagnosing dementia is sometimes a difficult diagnosis to make. There are many illnesses that mimic it, like a low thyroid disorder or a low B12 level or being depressed. So it's important to make the diagnosis. And unfortunately, a lot of the medications out there, we call them parachute drugs because they're going to slow down the disease at best. You're still going to hit the ground. And so trying to assess the goals of therapy is crucial so you don't get caregiver stress because it can get quite expensive to treat a dementing patient at home, much less in a nursing home.
Yeah, it can be difficult. And I think what's interesting is, we don't call it dementia we don't just say dementia. Really, that's more of a symptom, if you will. It's what kind of dementia? Is it a vascular dementia? Well, there's no medication that works for that. Is it Lewy body dementia? Well, there's really no medication that works or indicated for that. Is it Alzheimer's? That's the only one we used to think of. And now we have all the Parkinson's type dementia. You name it. There's alcoholic encephalopathy dementia. Most of these things don't respond to anything, nor have they been studied. We studied Alzheimer's, but it turns out, there's a lot more out there, and we're still trying to work out all those details. So it's going to be interesting to see what happens over the next decade. Moving on. Cardiovascular safety and testosterone replacement in older men. I can't believe we're still talking about this, but it's still another headline that we need to revisit because we still have older patients that really feel they need testosterone replacement therapy. Is it good or bad?
So guys out there in television land who are experiencing symptoms of low testosterone, unfortunately, unless we're really treating a medical condition that really requires this hormone supplement, it'd be best to stay away from it. It has cardiovascular, cerebrovascular side effects. I know we'd all like to have more lead in the pencil, but it's something you're going to have to live with.
Absolutely. I mean, there was actually one of the testosterone replacement companies that makes a product. They actually were doing a study because they thought that they really had stumbled upon the fountain of youth. And in very rare terms, they actually had to stop the study early. And that can either be really good or really bad. And in this instance, it was really bad. They just started killing people and realized that this was a horrible idea, giving diabetic men that have vascular disease, giving them something that's anabolic was just, on paper when you read it, like, this is probably a bad idea. And it was, who would have thought? So we should stay away from that. It's really a no-no. Let's take a little comparison of Xarelto versus warfarin for non-valvular AFib anticoagulation, specifically in people with severe kidney disease. Something when these medications first came out, we were kind of stayed away from people with renal insufficiency or failure, but now they've had a chance to study, and what's the news?
And across the board, all of these novel agents, Xarelto, Eliquis, have a unique safety profile compared to Coumadin. They all have less bleeding side effects across the board. So particularly in people with kidney disease, it's probably the right way to go.
All right, let's play a little match game.
All righty, what you got here?
What's the flap in the back of your throat?
Okay, I guess that's the epiglottis, right?
And how about your big toe?
I don't know how to pronounce that. Hallux?
Yes, there you go. How about the tooth layer under the enamel?
That's pretty easy. That's dentin.
The area between your eyebrows.
Oh, that's a Jeopardy question. I think that is the gabella.
Yes. And lastly, another word for your butt crack.
Well, the technical term is the intergluteal fold.
Yes, there you go. Very good. You pass. All righty. You could have been on the Jeopardy stars. All right, let's talk just real briefly, if we can. Try to sum this up. We're running out of time. But palpitations. People come in and say, oh, I'm having palpitations. What are they talking about? What are a couple of quick causes? Kind of food for thought. Maybe we can get to it on our next show.
Right. Well, palpitations, common symptom caused by a variety of issues. We're going to put the list up there for you. I think it's important to define where they're coming from. Could they be coming from the top of the heart or the bottom of the heart? Is it a question of something that has to be treated, or is it something you're doing to yourself, like having excessive caffeine and nicotine, giving yourself palpitations? As is usual the case in medicine, the treatment will depend on the diagnosis, and that's the key, is to try to diagnose these patients.
Right, absolutely. I think one other key difference is when people come to talk to me is, do they happen at rest or are they happening with exertion? If they're happening at rest, they typically are pretty benign. It's when they're exerting, with exertion, PVCs, that usually is a sign of some cardiac irritability, and that could be bad. That's something you really should talk to your healthcare provider about. You know, we have a lot more stuff here, but it's just going to have to wait. You know, I think we have to wrap it up and finish this last segment of It's Your
We will
Health.
talk to Sammy about extending the show for
To the
60 minutes.
the fourth segment. That's what I want.
There you go. Again, Happy New Year. Hope it's a good, happy, and healthy New Year for all out there in television land. Thank you for watching It's Your Health. We remain your leader in healthcare information.